Peace be to you all. AsSalama'laikum. This is Omar Abdul Malik, physician associate and health educator. So I wanted to do a quick video on hospitalist physician versus nocturnist physician. So I function in both capacities. I've been a PA for over 20 years. 6 of those years have been as a hospitalist, but I also function as a nocturnist at times when there's a need. So that means you cover the hospital at night. So your duties differ a little bit. So with hospitalist medicine, you'll usually do rounds in the morning with the various healthcare staff, so your nurses and various therapists and techs, and maybe the attending physician. And if you're at a teaching hospital, then you'll have residents and some students with you. And you see the patients on what we call the floor. So they're inpatients that are recovering from acute manifestations of chronic illness, whether it's COPD or kidney failure or something, or they had a traumatic event like a fall. Maybe they got dementia and they fell down the steps or something, or they were in a car accident or they got shot, which is very common in Anacostia, DC, Washington DC, where I work, unfortunately. But after being stabilized at the local hospital with an emergency room, and then through ICU or whatever, they're transferred to our hospital. Now, as a nocturnist, you're covering at night, obviously, nocturnal. And then what you do is you're responsible for the admissions. Hi there, good morning. Good morning. So maybe you'll admit a few patients. Hey there, how are you? Or several patients. It depends on what happens during that night. Sometimes you won't admit any patients at all, and it's what we nocturnists like to call a quiet night. There's no rapid response, there's no codes, so nobody's heart stops, and you gotta do a code with chest compressions and ACLS protocol, all that good stuff. Also, as a nocturnist, usually you won't be talking to people's families or interacting with them. That's usually along the duties of the hospitalist. So the families of the hospitalized patients will have questions about labs and prognosis and so forth. So it includes a lot of health education. Nocturnists, you may never see the families at all. As a nocturnist, you have to be able to function with a fair amount of independence, in your decision making and initiation of medical management. You got to know if there's certain tests that you need to order. You get a critical lab on a patient, suddenly their H&H, hemoglobin hematocrit, is low to the point where they need to be transfused. See what else about nocturnists? You have to have good communication with the nurses, with the floor nurses and the ICU nurses, if you're covering both, because then you have to say, okay, do I need to assess this patient? Does this patient need to be sent out? Do they have a sudden, acute manifestation of something to the point where it's beyond the scope of the health facility in which you happen to be working? You got to know when to call your consults. So your cardiology for acute decompensation of some kind of acute cardiac decompensation. Maybe nephrology. Maybe the person suddenly becomes old uric or anuric, like no urine at all, and their BUN and creatinine are all over the place. Or maybe they have signs symptoms of sepsis, and you got to start them on empiric antibiotics, but then you got to consult with infectious disease. So that's it. You might enjoy either. It really depends on what you want to do and the level of responsibility that you want to take upon yourself. and I guess the guidelines of your licensing agreement with your supervising physician, and your circadian rhythms. Like, I'm a night owl, so here I am. I'm doing a 10-mile run this morning, and I'm covering day, so I'm going to be at a hospitalist capacity. But this is Sunday, and I do long runs on Sunday, so here I am in these beautiful woods. Anyway, that's it for now. If you guys have any questions, please feel free to ask in the comment section. You can reach out to me if you're interested in becoming a PA or a health educator or runner. So, I just placed first in my age group at a local half marathon. Finished in 1 hour 47 minutes for 13.1 miles. That's much slower than I used to run. Hey, at 53, I thank God. Alhamdulillah, I thank God to be able to even be out here. Okay, that's it for now, guys. Peace.